I'm now going to talk a little bit about immediately after you've had your baby. So you've worked hard to have your baby, he or she's delivered straight up into your arms. Ideally you have uninterrupted skin-to-skin contact for as long as you like, at least an hour. Often women will breastfeed within this hour. Partners can do skin-to-skin contact as well. So encourage them to have a t-shirt on under their jumper so that they can take a layer off and have a nice cuddle with the baby if we're weighing the baby or you're having your stitches or something like that. Usually then you're going to have your shower, get sorted out upon labour ward. At the moment, partners aren't allowed to go down to the postnatal ward or be on the postnatal ward with you. But that's not to say you're going to be rushed immediately from labour ward. You're going to have a good hour or two with your baby and your partner straight after delivery. So once you've been sorted and everything's been done for you, your baby and your partner after you've had your baby, you're transferred down to the postnatal ward and say goodbye to your partner. You'll be on the postnatal ward for usually maybe the day or one night or 2 nights, or it depends if you're on certain types of drugs. You might need to stay in a few days if your baby needs to be under observations, or if you've needed antibiotics for you and your baby. Some women, if they feel well, are going home straight from the labour ward, and that's fine. But most women, I'd say, probably are going home from the postnatal ward area, and that might be if you had your baby this morning, you might be going home after tea time tonight, or if it was the afternoon birth, you might be going home just 12 hours later the next day, or 24 hours later the next day. The hospital will keep your maternity records. They get kept then in the maternity records department, and you're sent home with a postnatal pathway. Now, you'll hang on to this for the first week or so. The day after you go home from hospital at the moment, you're receiving a phone call consultation by your community midwife. Some of us are trying to get hold of a programme that we can do a face-to-face consultation with you, but otherwise it will be just a routine phone call. But we'll ask you about you and your baby and how you both are. You can, if you have a look at this, it's split into 2 sections. So the front section is all about mum, and you can see that we ask about your feeding, your stitches, if you're going to the loo okay, and then the back part of it is all about your baby, and again how the baby's skin is, the feeding okay, the cord, and how everything else is with that. And we'll usually document your care in here. If it's a visual contact over the phone, it's documented on computer from our point of view. You will have a home visit for the newborn screening blood test, and we'll weigh your baby at this appointment as well. Now, the heel prick test, as it's otherwise called, is you may well have had a booklet on it during your pregnancy. If you haven't, you can go onto the Newborn Screening Wales website and have a look. A little heel prick test for your baby, and if you can have a look at the card there, you see it, there's 4 circles here. So it's a little heel prick test, and 4 decent sized spots of blood are put on those circles here. Off to the lab then, and your baby is screened for 9 conditions. They're all rare. They range from cystic fibrosis, which you might have heard of, hypothyroidism you might have heard of, phenylketonuria, and then sickle cell is another one, and the other 6 are rare metabolic disorders. Some of them have been linked with cot death. It's thought that the sooner your baby is diagnosed, then the sooner the treatment can start, and the prognosis for your baby is significantly better. So this is done in your home when your baby is between sort of 4 to 6 days old, and this is still considered essential, okay? So we would still be coming out to perform this test on your baby. We would weigh your baby at this time as well. Routinely, we used to weigh all babies who are breastfed at 72 hours. It's now thought that it isn't always necessary to see you to weigh your baby, but if it was felt that the feeding wasn't going well or you had any concerns, then you certainly could have a home visit. But you can appreciate we're trying to reduce the amount of home visits we're doing. We will weigh all babies though when we come out to do the heel prick test, just to reassure you and us that everything is going well with your feeding. The good thing that's in here are some basic guidelines to how you know that your baby's feeding well, and I did put a little sheet up onto the Facebook page. But if you have a look in here at the baby's feeding assessment, it goes through how often your baby's breastfeeding, what the nappies are like, if you're getting lots of wheeze, and the baby's poo is changing colour from that dark black sticky meconium through to a greeny brown poo on day 2 or day 3, through to a yellow chicken korma type French mustard with seed type colour by day 4 or day 5, you can usually pat yourself on the back and think that your breastfeeding is going very well. Bottle-fed babies will have a more yellow putty type poo, and that's normal as well. Okay, so you just need to keep an eye on it and use, reassure yourself with common sense that if you're breastfeeding and your baby's got plenty of wet and dirty nappies, then he or she isn't dehydrated, and I'm pretty sure the weight will be fine. Okay.